Arkansas is reporting the highest number of whooping cough cases in 15 years. More than 500 cases have been reported so far this year, with most cases among school-age children and teenagers, according to the Arkansas Department of Health. ADH says that increase could be due to better recognition, waning immunity, and better reporting from health departments. Early symptoms can look like a common cold, a mild cough, runny nose, or fever, but after a few weeks, that can turn into severe coughing fits. In infants, whooping cough can cause pauses in breathing, turning blue, or trouble breathing. The illness spreads through coughing and sneezing. Doctors say the best protection is vaccination, along with covering coughs and sneezes and washing your hands frequently.